post-COVID, way from where we started until now, we are discussing post-COVID. We are in a position to talk about post-COVID now for Singapore because we, in a way that we are already adopted to live with COVID. And many of us are more than 90% already taking our vaccine. And as at these few days, we are looking at more than 1.2 million Singaporeans already diagnosed to have COVID. And there are many others who don't come forward to declare because actually they are not mandatory to do that anymore. So we all know there are people who don't declare. So look, from a population of about 5.5 million, we are looking at about 1.2 to 1.3 million already have COVID. So meaning 1 in 4 technically already have COVID. So it's quite a big number. So what about post-COVID? We all know COVID only 14 days, and I mentioned in many of my courses. But what after that? And from CDC USA, I would like to quote from the international source. Some people who have been infected with virus that cause COVID-19 can experiencing long-term effect from their infection, known as post-COVID condition, PCC, or we call it long COVID. And in the particular chart I shared last time, around 10% to 30% of those who have contracted COVID-19 appear to be suffering from ongoing long-term effect of the disease despite the virus no longer being detectable. And among them, a significant portion of COVID-19 patients are suffering from prolonged post-COVID-19 fatigue syndrome, with characteristics typically found in chronic fatigue syndromes. This was found in the earlier research done by New Zealand institution. So we are looking at 30%. So in the population of size of 1.2 million already contracted COVID, 30% is significant numbers. So among all of you here, I believe some of you already contracted COVID. Post-COVID condition can include a wide range of ongoing health problems, and this condition can last for weeks, months, or years. So this is not something to be easy to ignore, because while modern medicine is not able to address a functional weakness, there are other medicine systems that can be able to help. So post-COVID conditions are found more often in people who have severe COVID-19 illness. So while you're having the COVID virus in you, how was you managing the condition? It matters. But anyone who has been infected with this virus that cause COVID-19 can experience post-COVID condition, even people who have mild illness or no symptom whatsoever. So most of them I'll explain or I'll discuss what are the typical post-COVID conditions. So people who are not vaccinated against COVID-19 become infected may also have a higher risk of developing post-COVID conditions compared to people who were vaccinated and have breakthrough infection. I mentioned before, in my other sharing, you can go online to look for it. A vaccine doesn't stop virus from coming. The vaccine reduces the impact of the virus to the minimum. And subsequently, your internal immunity have to come in place to fight off whichever remain. So that's why we mentioned about when you have vaccination, eventually when you get COVID virus, it becomes a normal flu. But if your immunity was so low, then that normal flu can actually cause harm to you as well. So a vaccine doesn't stop virus from coming, it reduces the effect. So for those yet or never went for vaccination, their risk of developing post-COVID condition become higher than normal. So there's no single test for post-COVID conditions. While most people with post-COVID condition have evidence of infection or COVID-19 illnesses, in some cases, a person with post-COVID condition may not have tested positive for virus or known they were infected. Because why? As I mentioned, if you are already vaccinated, a virus eventually passed through, we call it the breakthrough infection. Your immunity was so strong that it can just sneeze, and that's all you have as far as the COVID is concerned. So to you, it's a known event. But while that non-event itself, damage has been done in a sense. So there are cases happening.